Hello, my name is Umar Salim, and this presentation is for the infectious diseases epidemiology. Today, I'll be giving a concise overview of Candida auris in Texas, an emerging multi-drug resistant fungal pathogen that poses a growing challenge to healthcare facilities. I will summarize the current epidemiology, how C. auris or Candida auris spreads, what Texas is doing now, and the most important actions needed to prevent wider transmissions across the street. So, coming on to the overview, Candida auris is a highly resilient and multi-drug resistant fungus, which basically spreads easily in healthcare settings. It survives on surfaces for longer periods and can resist common disinfectants, which allows it to persist in hospitals, long term care centers, and other high risk environments. Because many patients remain colonized without showing symptoms, C. auris can spread silently unless facilities conduct screening and maintain strong infection control practices. Slide 3, the epidemiology again. In 2021, Texas identified around 2,261 total cases of Candida auris, and most were concentrated in the Dallas-Fort Worth region. Clusters were predominantly linked to long-term acute hospitals and ventilator-capable nursing facilities, settings where patients have prolonged hospital stays and depend heavily on on invasive medical devices. So these conditions create opportunities for sustained transmission. The geographic concentration of cases show that targeted regional action is very crucial. So when it comes to transmission, Candida auris spreads through direct contact with colonized or infected patients and indirect contact with contaminated surfaces or shared equipment. So healthcare workers, especially, their hands, reusable devices like thermometers and blood pressure cuffs and environmental surfaces are all common pathways through which it basically transmits. So because colonization can persist for months, the organism can move between facilities during patient transfers, which needs to be kept in mind. So this makes consistent infection control and communication between healthcare settings absolutely essential, which you really need to focus on. So, what are the current strategies? Again, Texas is currently, I would say it currently requires mandatory reporting of Candida auris, C. auris cases and relies on several infection prevention strategies, including hand hygiene, contact precautions, and use of EPA approved disinfectants. However, implementation varies. Some facilities lack rapid testing capabilities, others struggle with limited staffing or training, and long-term care environments often face resource gaps, which is really important. These inconsistencies allow C. auris or Candida auris to persist and sometimes spread undetected. So what are the recommendations? Uh, to basically strengthen Texas response to C. auris cases or Candida auris, five actions are recommended. So these five actions are screening, IPC training, transfer alerts, lab upgrades or lab upgradation, and support facilities. When it comes to screening, high risk patients, and this needs to be kept in mind, high risk patients should be screened at admission to detect colonization early and prevent silent spread. And after this, coming on to IPC training, again, facilities need routine infection prevention training to ensure consistent hand hygiene and personal protective equipment use and environmental cleaning. Thirdly, again, transfer alerts, a system or a universal transfer notification system should communicate patients' C or S status so receiving facilities can implement precautions immediately. And after then is basically lab upgrades or lab upgradation, expanding access to PCR will basically reduce misidentification and improve response speed. And lastly, support facilities, which is also very, very essential. Under-resourced nursing homes and correctional health units require targeted support, including supplies, staffing, and on-site training. So combining all these steps, basically improve the short-term and long-term, outcomes, and basically it strengthens all the gaps which we basically face in not properly tackling the CRS cases. And so, in conclusion, the lifestyle, and I would like to give you a whole summary that Candida auris is an urgent but manageable. That needs to be kept in mind. It is manageable public health threat in Texas. Again, its ability to spread quietly and resistant treatment highlights the need for early, detection and intervention, strong infection control practices, and effective communication between facilities. So by implementing the recommended screening, training, transfer alerts, and laboratory improvements and target support, Texas can prevent CRS from becoming established and protect the vulnerable patients across the states. So this was my small presentation. Thank you for your time.